I'm Dr. Evelyn Duffy. I'm the Florence Seller Professor of Gerontological Nursing at Case Western Reserve University in Cleveland, Ohio. I had the privilege of serving as a president of GAPNA from 2010 to 2011. I really became interested in policy during that time period. I served as the chair of the Health Policy Committee for a number of years, and I still serve on the committee. I'm here today to talk to you about how the government works or doesn't, and the political process. I want to encourage you to be involved in policy, whether it's at your local level or in DC or at your state house. So how the government works or doesn't. First of all, what is policy? Policy has been defined as a definitive course or method of action selected from alternatives and in light of given conditions to guide and determine present and future decisions. That's the Webster definition. Health policy involves authoritative decisions made and actions taken by governments that pertain to health. And this can happen at the local, state, national, or even the international level. Formal governments and government organizations are often what are involved in the policymaking process when it comes to health policy. I think that one of the lessons we learned from COVID-19 and now monkeypox is the importance of working globally. The UN Sustainable Development Goals speak to some health policy recommendations, and the World Health Organization has been integral to the global response to emerging health crises. At the national level, the United States Department of Health and Human Services sets standards for long-term care institutions that are implemented through the Centers for Medicare and Medicaid Services. Additional policies can come from the State Department of Health and may be further addressed by the county, and even the municipality may set policies, for example, about the architectural standards required for a long-term care institution. So policy can happen at any level. And then within an institution itself, policies can also impact the practice of the nurse practitioners or clinical nurse specialists, or they can impact the care that you provide to patients. So you may have heard people talk about big P policy and little p policy. There's not an in-stone definition for these two, but in general, big P policy is created by governing bodies, either at that national, state, or local level, or it could be international. At the national level, when a law is passed that requires federal money, another law needs to be passed to fund the initiative. This funding comes from an appropriations bill. Laws can be passed that actually never get funded, or they may need to have their funding renewed on a regular basis. For example, the Older Americans Act that supports food programs, for example, in the local level. Little p policy is often about implementation of big P policy. Big P policy is not more important just because it's got a big P. Think about the Affordable Care Act that provided for Medicaid expansion, big P. However, as states implemented the ACA, many chose not to expand Medicaid. So that little p decision was a more critical determinant of the health of millions of Americans in some situations than the actual big P policy that was passed. States have passed big P policies providing for full practice authority for APRNs, but in many of those states, individual institutions have made little p policies that limit the practice and require physician collaboration or even supervision. So both big P and little p policy can be very impactful. When you think about policy more broadly, it's easy to identify ways in which you can personally advocate for the care of your patients or for your practice. Recently, in the institution where I have my practice, our APP director was able for the first time to get an APRN on the credentialing board of the hospital. Nurses advocating for their patients every day know what it means to advocate. And that same skill set is what we can use effectively to move policy forward. So policy can be a law, like gets passed in Washington or in your local state house. It can be a regulation, a rule that comes from the law to talk about how it's going to be implemented. It could be a resolution or a position statement. And a goal can be simply a goal can be a policy. The population competencies that inform our practice and define our scope of practice is an example of a little p policy that was not decided on by a government, but it definitely impacts our practice. And often it impacts how policy, big P policy, is written. Credentialing is an example of policy, practice privileges, and rules. So all of those are examples of policy. It's much, much broader than just laws and regulation. GAPNA is very involved in advocacy at the national level. Members of GAPNA represent the organization on several advocacy coalitions. To best represent GAPNA on those committees, members need to understand how the government works. A recently elected senator to the United States Senate, when asked about the three branches of government, replied the president, the Senate, and the House. So it may have been a long time since you took high school physics. So here's a quick review. And I want you to come away knowing what the three branches of government are and accurately answer that question. The Constitution defines the three branches of government as the legislative branch, the executive branch, and the judicial branch. The legislative branch includes the Senate and the House. Every state has 2 senators, and each is elected for a 6-year term. So about a third of the Senate is up for election every 2 years. There are a total of 435 members of the House. They serve 2-year terms, so all of them are up for election every 2 years. The number of representatives in the House was set in 1929 by the Permanent Apportionment Act. They are distributed every 10 years based on the state's population count in the census. That is one reason that the census is so important. In 2021, some states gained a representative while others lost a representative. Texas actually gained 2 seats in the House, and my state, Ohio, lost a House seat. The executive branch of the government includes the president, the vice president, the cabinet, and most federal agencies. The cabinet includes the head of the departments, Defense, Treasury, the Attorney General, for example. They are appointed by the president and confirmed by the Senate. The federal agencies under the executive branch include the Department of Agriculture, Health and Human Services, Commerce, Defense, the Department of Energy, again, to name a few. The judicial branch includes the Supreme Court and all the lower federal courts. The president nominates and the Senate confirms all justices. In 2013, there was a Senate vote to allow a cloture motion to be defeated with a simple majority rather than a 2/3 majority. That decision did not apply to justices of the Supreme Court. However, in 2017, the Senate standing rules were changed again to allow for filibusters of Supreme Court nominees to be broken with a simple majority. This made a big difference in the number of justices that were appointed by President Trump. Anyone can draft the language of a bill. GAPNA could propose language. They could bring it to a supportive member in the House or the Senate, and if the member or members of Congress decided they were going to propose your legislation, it would get drafted and it would go to the Office of Legislative Counsel. There is an Office of Legislative Counsel in the House and another one in the Senate. That office includes teams of lawyers with specific expertise. to evaluate the bill and help identify the laws that would be affected by the proposal, and then determine which committees would get assigned to the bill. Most of our issues affect Medicare or Medicaid law. In the Senate, those bills are assigned to the Senate Finance Committee, and in the House, it's the Ways and Means Committee if the bill is about Medicare, and Energy and Commerce if the bill would be affecting Medicaid. Another important law that we need to be aware of is the Public Health Services Act. Title VII and Title VIII of that act address healthcare workforce issues, and they also fund nursing and APRN education. The House Committee on Education and Welfare and the Senate Committee on Health, Education, and Labor may have jurisdiction over any proposed legislation that address those educational and workforce issues. All of these committees have subcommittees that focus on specifics, and the chair of the committee can assign the bill to the subcommittee, but ultimately all bills need to be heard in the committee itself, and testimony is given in that area. All funding bills need to start in the House of Representatives, but the Senate may propose amendments to any funding bill. And sometimes that means that the bill barely resembles what was passed in the House. And we'll talk more about what happens if that occurs, that bills are very different in the House and the Senate. It takes a simple majority to pass a bill in both the House and the Senate. So why does so much legislation pass the House and not even get a hearing on the floor of the Senate? This seems like a really good time to talk about the filibuster. Actually, it does only take a majority to pass a bill in the Senate. So you may wonder why you hear so often about needing 60 votes to pass legislation. The 60 votes are what is required to bring cloture to the discussion on the Senate floor. The discussion regarding the bill can be used by opponents to delay the vote or prevent it from being voted on at all. The Senate Majority Leader decides what will be heard on the floor. And if he knows that he doesn't have the 60 votes to bring cloture to discussion, he may not even bring the bill to the floor. There are several types of bills that cannot be filibustered. Appropriation bills, for example, are a type that cannot be filibustered. So for appropriation bills, it only takes a simple majority in the Senate and a filibuster cannot occur. It's one of the reasons that in our current very closely divided Senate of 50 Republicans and 50 Democrats, that many times the strategy of the majority party, the Democrats, because of their ability to have Kamala Harris, Vice President Kamala Harris, do the deciding vote if there's a tie, they've chosen to try and make the bill into an appropriations bill so they can avoid the filibuster. When a bill is passed in both houses, unless the language is identical and is not changed in the committee or on the floor, it goes to the conference committee to resolve any differences. So if two bills are passed, but they aren't identical, they need to go to a conference committee to resolve any differences. Then the new version must go back to both bodies to review and be voted on. And then when it's passed, it goes to the president for signature. The president must sign a bill within 10 days. If he vetoes the bill, it could still become law if the House and the Senate override the veto with a 2/3 majority. If the president doesn't sign the bill or veto the bill in 10 days, and Congress is no longer in session, the bill becomes vetoed, and it's called a pocket veto. So the president himself didn't veto it, but it is not going to become law. If Congress is still in session and the president doesn't sign the bill in 10 days, then the bill becomes law without the president's signature. So those are kind of some interesting caveats at how a president, if he doesn't agree with the bill, could not actually oppose it or support it and still have it become law or have it be vetoed. Once a law is passed, the work of the advocacy groups does not end, because once a law is passed, the rulemaking occurs of how the law is going to be implemented in practice. The law is assigned to the federal agency that's responsible for implementing it. And for healthcare laws, it's usually the U.S. Department of Health and Human Services. For Medicare and Medicaid, it goes to the Center for Medicare and Medicaid Services. And for those workforce issues, it would go to Health Resources and Services Administration, both of which are under HHS. When the rules are created, they cannot go against the statute or the Constitution. Rules are created that interpret the law and decide how it's going to be implemented. During that rulemaking process, our membership needs to be involved, because the Federal Register is the place that you can actually comment on the proposed rules. The physician fee schedule is an example of rulemaking regarding revisions to Medicare reimbursement. Comments are open to the public, and advocacy groups that GAPNA members sit on monitor those changes that might affect our membership, so that we can encourage you to get onto the physician fee schedule in the Federal Register and make responses to the comments. This year, that comment period closed on September 6th, but every year it's open from about July to September, and it sets how Medicare is going to be reimbursing all providers in the following year. These are a list of the areas where you can find the agendas for the committees, and also the regulations, and where you can make comments. Another resource that's very important, especially to those of you working in long-term care, is this Medicare Matters site, which can often be your go-to source if there's a controversy about what you can and can't do in practice. Many times, hospital administrators and long-term care administrators do not know that things had been changed, and they are practicing under old beliefs that have been modified and reported in these MLN Matters articles. They can be searched by topic, and they're very good resource for you to use to advocate for your own practice and your patients. Every year, thousands of bills are introduced and assigned to committees, but rarely is any individual bill introduced and debated on the floor. 90% of bills die in committee or subcommittee. So you may think that it's really hopeless. However, many bills become part of another piece of legislation. They get grouped together, and that's what goes forward. This site, www.govtrack.us, can give you an estimate of whether or not a bill that you're interested in has a chance of passing. But again, it doesn't mean it will never see the light of day, because it may be that it would be combined with another bill. From political science, we have a model that helps us know how to move policy. Regardless of what you want to change, whether it's a big P policy or a little p policy, these three factors need to align in order to open the window of opportunity for change. I can't think of a better example of this than the inclusion of the Home Health Planning and Improvement Act, which had been introduced every year in the House and the Senate from 2007. Then COVID-19 occurred. The problem that we had new models of care as people were staying home and we were utilizing telehealth, and the need for home health services increased dramatically. House Resolution 748, the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act, included the Home Health Planning and Improvement Act in its entirety verbatim. and it was signed into law in March of 2020. So that was an example of where a proposal that we had been putting forward from 2007 ended up with the right problem and the right political environment to get it passed. And now it's become the law of the land. This is a very busy slide, but I wanted to point out that it incorporates King Don's agenda setting into this larger model by Longus. Both of these are political science models that look at the fact that once a law is passed, it builds on the fact that as it's implemented and rulemaking occurs, there always become unintended consequences. You never know what the caveats of the law were until you actually get it out there and implemented. And so consequently, it's an iterative process. It continues to feed on itself. You identify areas that were not covered adequately or areas that were over addressed, and those need to be modified by going back to the formulation phase and proposing an amendment to the law that then you have to look for another window of opportunity to bring it forward and to make that change to address whatever the problem is. Mary Wakefield, a nurse who served as the Deputy Secretary of Health and Human Services under Obama, identified these 9 factors that can help move legislation. It's usually one of these that ultimately helps open that window of opportunity and allows legislation to become law. To emphasize again that these same factors can influence your little p policy work as well as big P policy work. You can look at the fiscal pressures or market forces. You can talk about crises. All of these can be part of the problems and the opportunities that allow you to move forward in something that maybe had been mired for a long time without moving into any change. This slide, I've given you some examples of each of these 9 forces that were identified by Mary Wakefield. I'm sure that you can think of many more. And depending on your situation, if you look at these 9 factors, you can think about what might help move forward a change that you would like to see in your practice or in your state house or nationally. So to move policy forward, you need to be at the table. I mentioned that GAPNA is at many tables that advocate for nurse practitioners, advanced practice nurses as a larger group, and nurses in general. If you're not at the table, you're on the menu. You need to have a voice. Your voice can be heard through your vote. You could belong to a professional organization, and since I'm talking to you as a member of GAPNA, I'm thinking that you are a member of a professional organization. You should also think about being involved in your local professional organization to make that impact locally. You can support a political action committee. Political action committees raise money to help influence elections or legislation. We don't have a PAC in GAPNA, but the American Association of Nurse Practitioners has a PAC. The American Nurses Association has a PAC. Those are important vehicles for those organizations to support congressmen so that they can have their voice heard in Washington. Those groups are all focused on Washington. They usually make the split pretty 50-50 between the parties. In the past, the ANA had been more strongly Democrat supporting, and the AMA had been very strongly Republican supporting, but I think in the past few Congresses, they've really become much more even in their influence of who they give money to and donate to. Supporting a PAC in nursing is important because the AMA PAC is so much better endowed than either nursing PAC that I'm aware of. The AMA PAC has almost $3 million that they can use to influence legislators in Washington. In comparison, the American Nurses Association has about $800,000, and the American Association of Nurse Practitioners has almost $1 million. This data comes from opensecrets.org, and you can also monitor those PACs if you're interested using that tool. The organizations themselves don't always have that easy information to find, so that's a source that can be useful. You can support a candidate. Midterms are coming up, and a lot of people ignore midterms, but this year the midterms are more important than ever. There's a lot of candidates that really haven't had experience in governing at all, and there are other candidates that you may not want to support their policies. So find somebody that you align with, whether you're a Republican or a Democrat, and help them get elected. You can knock on doors, you can make phone calls, you could put a sign in your front yard. All of those are easy ways to support a candidate and to become involved in the political process. And finally, you could run for office. Right now, there are 3 nurses in the House of Representatives, and that's an important voice. Even if they're politically diverse, although all 3 nurses that are in the House right now are Democrats, they still bring to the Congress a perspective that isn't necessarily held by any of the laymen that are there. So I encourage you to get involved in the political process and to support GAPNA, as we have a lot of people that are very committed to having our voice heard in Washington and also locally. Thank you very much for your time.